Just a little bit of a warning, I do refer to schizophrenia with SZ on the PowerPoints. It does mean schizophrenia. Cognitive behavioural therapy, or CBT for schizophrenia, as a treatment. CBT is based on both cognitive elements as well as learning theories, and it addresses the thinking and behaviour involved in schizophrenia. It can be done in one-to-one sessions or in group therapy over a number of weeks. It can be done through self-help books, online, or family therapy, or structured activities. Patient-therapist relationship is important during CBT, and focusing on the therapist being non-threatening and supportive. CBT involves examining the things you think and do, focusing on goals and the present day and how your thoughts affect your feelings and behaviour. Belief modification is challenging the delusional thinking directly and testing it against reality. Normalizing is destigmatizing the psychotic experiences, using relaxation techniques and activity planning to normalize psychotic experiences so they don't feel as overwhelming. Motivational interviewing identifies a person's goals or values and seeks to help them to change and find out how they can change. Focus and retribution. This reduces the distress of hallucinations. It focuses on the characteristic of voices and patients' records of what they say. Skills training, learning to self-manage and how to find support. Social skills and life skills are learned. Psychoeducation. Now, Valentine 2010 did interviews about psychoeducation and whether or not it helps schizophrenic patients. Psychoeducation is where you learn about your illness, recognize triggers, learn about relapse and what relapse looks like. This reduces the blame but also helps patients to see what their disorder means and how knowing about the disorder can help them to try to get better. How is CBT used for schizophrenics? Therapists try to challenge the differences between psychosis and reality. They try to get patients to realize when they're hallucinating by filtering through and paying attention to reality. For example, by trying to get patients to say, it's just a voice, and by noticing it's not real. Therapists try to challenge delusions by asking for evidence against the delusions. Dickerson 2000 found that CBT alleviates symptoms and is 60% useful as they are unable to live normally due to the symptoms of schizophrenia. Maladaptive thinking, thinking that is not helpful or suitable, comes from schemas and general beliefs about the world, oneself, and the future. CBT focuses on learning how individuals who suffer from schizophrenia struggle with social isolation and lack of social support. They resolve this issue through working with a therapist or through group therapy. Strengths. Kingdom and Turkingdom 1991 found that 35 out of 65 in a 5-year follow-up were free of symptoms after CBT. 62 out of 65 were living in their communities. However, an issue with this research is that it was a small group of participants with no controls and there was nothing to compare it to, making it ungeneralizable and unreliable. Patient-therapist relationship is very important. They work collaboratively. They make the individual feel safe and supportive. The patient gets to make decisions for themselves and they are tailored towards their needs. It can lead to better long-term outcomes as shown by Kingston and Turkington research. Chadwick and Lowe 1994 found that when behavior modification was used, 10 out of 12 patients had a decrease in convictions of beliefs. 5 out of 12 rejected delusions. However, this was also a small sample size. Hoffman et al. 2012 used a meta-analysis and found CBT was best for anxiety disorder, anger control, stress, compared to other treatments. It was effective for both positive and negative symptoms. It's important to note that CBT treats both positive and negative symptoms, especially when comparing it to other treatments like drug therapy. Weaknesses. Unethical. CBT can be distressing. Patients need to question their hallucinations and delusions, as well as their own beliefs, questioning their sanity. Ethics. Informed consent. Patients can be having delusions, hallucinations, disorganized thoughts, and memory issues. They may not remember giving consent, or consent may be given by a guardian. Therapists can manipulate patients. Therapists and patients may get too close, and they may not like the therapist. They may have delusions about the therapist. CBT is needed to be used alongside other treatments so that the individual has motivations or the capacity to do CBT. Therefore, it cannot be seen as the overall treatment for schizophrenia.